Hello, Dr. Weiner here from Central Florida. Today we're going to talk about physical exams and why they're so important. You get a lot of really good information from a physical exam, and so sometimes you might wonder why a vet might require a physical exam just for a rabies shot or something. But there's a lot of really good information that you learn from that. Even things that might be undetected at home, might be picked up on a physical exam before they become a problem. That way we can be more proactive instead of reactive. And then that allows us to plan a little bit better and be on less of a time crunch, which also cuts down on cost. And then we're working on more of a stable patient instead of a critical one. Just sort more of an extreme example. Some things are much more subtle, but definitely a good thing to have. Learn a lot of information. So I'm going to kind of walk you through my physical exam. Everyone's might be a little bit different, by trying to go in the same order every time, is that way you never forget anything. So let's get into it. First part of the physical exam is really just observing the pet from a distance without even touching them. So I usually do this while I'm talking to the owner about getting history and how everything's going. Looking at how the pet's doing. Are we bright and alert, responsive? Are we quiet? Are we depressed? Are we able to get up and walk around, limping at all, that sort of thing. Once I've sort of established that, of course I'll introduce myself to the pet and everything. This is Lady. She's actually my own personal dog. So she's going to volunteer for us today. I typically work from the nose and work my way back to the tail. And what I'll start with is, does the face look nice and symmetrical? Is one eye droopy or a lip droopy, or the face swollen at all, anything like that? And then I'll look at our eyes, see if our palpebral reflexes work. Do a bit of a menacing gesture, see if our menace response is there. Same thing on this side. And all that looks good. Then look at the nose, nice and symmetrical, no nasal discharge or anything. Look at the teeth, gums are nice and pink. Any discharge, any tartar or anything? No, that looks pretty good. Same sign on the other side. Then open up, look at the tongue, anything under the tongue, gag reflex, that sort of thing. So all that looks pretty good with Lady. Under here, I'm feeling for lymph nodes. Lymph nodes can be elevated or enlarged if there's any sort of infection, or it could be a systemic issue as well. Then I'll massage the windpipe or the trachea, see if we can elicit a cough. And then there's another set of lymph nodes I can feel down here as well. So with Lady, that all feels really good. Then I'll go back to the eyes, and there's a few ways to do this. What I'll look for is our eyes nice and clear. We respond to light normally. So we'll get a light on there. Corneas are nice and clear. Inside the eye is nice and normal. When I try to light in their eyes, she does squint a little bit, so that's called a dazzle, and her pupils do constrict appropriately, so her eyes look nice and normal. And then I can get a light in there and look at the back of her eye, which the camera probably won't be able to pick up, but I'd be looking for retinas. Are the retinas detached? How's the back of the eye, the optic nerve look, that sort of thing. Then I'll go to the ears. Ears are weird. Not a lot of dogs don't like that, and it's sometimes kind of ticklish. But if we kind of cover their eyes, it might be a little less scary. Looking at the ear flap, nice and normal there. Then I stick the otoscope in. Looking for an eardrum. I'm looking at the lining of the ear canal. Everything looks nice and clean. It's pink, it's not red. Eardrums are nice and intact, so of course they're on both sides. And everything looks really good with Lady. Good girl, way to go. Okay, at this point we'll spin around and start at this end. So first I just kind of put my fingers here, and I'm actually feeling for the femoral pulse. And so I'll typically count that for about 15 seconds to get a pulse rate. I'm detecting if the pulse quality is nice and strong, if the rate is nice and normal, and then I take my stethoscope and listen to the chest, and what I'm listening for are heart sounds, rate and rhythm, and then lungs as well. So take a listen to the heart. So it's a nice, good steady rhythm, normal rate, nice strong lub dub. And then the lungs. So the lungs are nice and clear. I don't hear any crackles. Breathing rate and effort are nice and normal. So chest is great. And then sometimes I even do one of these guys where I'm percussing the lungs. It should sound like a drum, which it does. If it sounds dull, that makes me worried about any kind of fluid around the lungs or anything like that. So, so with Lady, chest is perfect. Then I'll kind of part the fur, looking for any skin lesions, fleas, any sores or anything like that. Kind of feel all over, see if I feel any crusty areas or masses or growths or anything like that. Next is the abdominal palpation, where I'm just feeling her belly. And what I'm looking there for is any painful spots. Can I feel organ size? Do her organs feel a little big to me? Obviously, this is somewhat subjective. It's one of the more difficult things to learn. But the more you do it, the kind of more you get used to what a normal belly feels like. So I'm looking for organ size. Do I feel anything in there that doesn't belong, like a mass? Is the bladder normal in size, or is it really big and tender? But Lady, everything feels good. There's one more set of lymph nodes back here. Then I'll kind of just go through range of motion of all the joints. Do we have normal range of motion? Do we kind of resist movement? Are the bones painful? Or the joints kind of achy or crunchy when I'm manipulating them? She doesn't seem to care. She's a nice young dog anyway. And then sometimes, as a good thorough physical exam, you'll do a rectal. I think I'll spare Lady today for demonstration purposes, but overall she looks great. So you can see, you get a lot of really good information from a physical exam, from kind of a nervous system, looking at the cranial nerves, making sure we know where our feet are in place. We did a bit of a cardiac exam. We looked at the eyes, the ears, the teeth, skin. So we're really looking at the whole dog, from nose to tail, to detect any kind of abnormalities. But today, Lady gets a clean bill of health. So if you have any questions, of course, feel free to contact your veterinarian. And that's about it. Thanks.